Right, in this particular lecture, we're going to talk a little bit about evaluation of kidney function. With the evaluation of kidney function, I want to talk to you primarily about three different tests, or really four different tests, but two of them are combined. The first of those tests is called a urinalysis. This is a basic screening procedure that basically is going to give you a little bit of information about what components may be present within urine. Usually it's kind of performed in-house by placing urine onto a stick. The stick has different reagents that react with the urine, and it usually detects for various abnormal constituents, some of which you can see here. I want to call your attention to a couple of these constituents. The first of which you'll see is called albumin. Really, you could put proteins there. Albumin/proteins are usually not found in the urine. Remember that they are typically reabsorbed by the proximal convoluted tubule. Now, should you detect or should the urinalysis show that there is protein within the urine or albumin, there's two terms that you should remember that relate to that. The first is albuminuria. Albuminuria specifically relates to albumin being present in the urine, but then more generically we could say proteinuria. And proteinuria is just proteins being found within the urine. Typically, proteinuria results from some type of damage to the filtration membrane that results in excessive filtration of proteins, and basically once you filter too many proteins, your PCT can't reabsorb them and they end up within the urine. Second, glucose. Glucose shouldn't be found within the urine. PCT should reabsorb most of that, but we usually detect glucose within the urine, a condition called glucosuria, in diabetic conditions. The excess glucose within the blood usually means that you filter too much glucose, and once again the PCT, if it can't reabsorb it all, it ends up within the urine, and that can become a problem. So glucosuria is glucose within the urine. And lastly, you see up there red blood cells. If we detect red blood cells within the urine, it's referred to as hematuria. Now, hematuria can have many different causes. For instance, an individual could have a kidney stone that maybe causes some damage within the urinary system, and that may cause some slight bleeding or hematuria upon urinalysis. Also, other conditions such as urinary tract infections or cystitis or bladder cancers, these can also cause some appearance of blood within that urinalysis. One of the more common issues that we usually run into are women who are menstruating. Usually a contaminated sample containing menstrual blood, it'll still appear positive for some blood. In other words, it'll appear positive for hematuria. So you can see a few other abnormal constituents also listed here within the chart. You can take a look at those, but definitely keep in mind those terms that I just mentioned to you: proteinuria, glucosuria, and also hematuria. They may work their way back around. Now, I want to just take a quick, if I can get to my chart here. I don't have it in this one. I just want to say a couple of words very quickly here about the appearance of urine. Because although we do use the urinalysis kind of as a standard test, we do also consider the physical appearance of urine. Usually it should be fairly translucent, usually anywhere from colorless to various ranges of yellow or amber, depending upon the level of water within it. More water, usually a little bit clearer. Obviously, if you have more concentrated urine, usually you'll see more of a deeper, darker yellow, gold, amber type color to it. Usually urine is anywhere from odorless to mildly aromatic in smell. And if you look in your book, there is a table, I don't have it in this set, but it lists for you things like the specific gravity and things like this. But those physical characteristics of urine can all be altered based upon various conditions. For instance, if a person is under antibiotic treatment, usually with an antibiotic called vancomycin, which is metabolized by the kidneys, the urine can take on a reddish color. Sometimes simply the ingestion of various food items like asparagus may change the smell of the urine. So there's some standard physical characteristics of the urine, but understand that they can be altered by what's happening metabolically within that individual. Next, we'll just quickly mention two blood tests that are performed. They're called blood urea nitrogen and also creatinine. They're kind of done in combination with each other. Obviously, these are a little bit more invasive, the reason being that you have to actually draw blood, venous blood, in order to do this. And both really look at nitrogenous waste products. You can see if you get into the book, you'll see the blood urea nitrogen, the BUN, is a level that results from the breakdown of amino acids. Usually, you'll see it rise when GFR is too low. So if the filtration rate is low, usually you'll see an elevation in the blood urea nitrogen, and typically that usually means that this person may have a diet that's high in protein. So usually we'll tell them, hey, tank back a little bit on the protein intake, eat fewer proteins, and that may help correct that BUN. Creatinine is a breakdown product of muscle, and basically it's used to indicate renal function. If your creatinine level is low, or rather if your creatinine level becomes elevated, it usually indicates some decreased renal functioning, whether that's with the filtration rate or something else. It's kind of tricky. We have to do some more investigation, but usually we use those two blood tests together, the BUN and nitrogen, in order to try and evaluate the overall kidney function from that standpoint. The final test is the kind of what we usually refer to as the gold standard. If you really want to know how a person's kidneys are functioning, we usually will ask for this test. But it's the most invasive and the most involved of the three tests. It's called renal plasma clearance. And basically, it tries to see how effectively a person's kidneys can remove a substance from their blood. There's usually typically a molecule called para-aminohippuric acid, PAH, is used. It's a molecule that once it passes through the renal corpuscle is filtered completely in one pass, and then it's neither reabsorbed nor secreted. So what is filtered is what you get back. Usually you have to infuse that molecule into a person, so you have to set up an IV, and then the urine is collected, and from there the urine will be evaluated for the presence of the PAH. So you can see it's a pretty involved process. Infusion, IV, collection of urine, and measuring the PAH, all involved. But it does definitely give you the best physical picture of how those kidneys are performing. So those are your three tests. You got your urinalysis, simple tests commonly done in usually any physical exam. You've also got the BUN and creatinine blood test that give us a little bit more indication of the functioning there. And then the gold standard, the renal plasma clearance.